So one of the main reasons why I was compelled to connect to and work with the Health Workers for Palestine group here in the UK was because of my own experiences working in Palestine in the mobile clinics for the Palestinian Medical Relief Society. And, you know, this was 5 years ago now, and even then we saw an increase in attacks starting at that point against healthcare workers. We had people that were protesting in Gaza at the borders, part of the Great March of Return, and one of our nurses, Razan Najjar, was martyred. They directly shot at her deliberately, despite the fact that she was wearing her vest. And I started to see that in the West Bank myself, where the mobile clinic would often come under fire. We would often be attacked with tear gas. We would often be shot at. We often had tanks coming and charging towards us. A lot of the teams are prevented from being able to access the communities that require their care. A lot of the paramedics are often stopped with the patient literally right in front of them, bleeding to death. Unfortunately, only a few weeks ago in Bethlehem at Aida refugee camp, a young man who was studying early in the morning was shot at, and the paramedics were prevented from being able to reach him until he had bled out in front of the paramedics, and then once he had died, they were allowed to go and see to their patients. So I was always very much concerned about my healthcare colleagues with PMRS, but also just with respect to the healthcare sector. And then once we started to see what was happening after the 7th of October in Gaza, to see my colleagues being deliberately attacked and hospitals coming under fire and being bombed, and the humanitarian aid being prevented from entering Gaza, I felt that it was my duty and my responsibility to do what I could for my colleagues and for my peers that are stuck in Gaza, and essentially act in a way that I would hope others would act for me if I was, God forbid, in a similar situation.
في الوقت الحالي أنا الطبيب الوحيد المتواجد، إضافة إلى عدد من الممرضين والممرضات، وكما تعلمون يوجد العديد من الحالات جزء منها خطير وحرج، وهم بحاجة إلى متابعة مستمرة. الشيء الآخر، محطة الأكسجين المركزية تم تعطيلها من قبل قوات الاحتلال الإسرائيلي حينما اقتحمت المجمع قبل حوالي شهرين.
We are on the third floor of Nasser Medical Complex, in the place where Limb Reconstruction Center used to operate until the hospital was out of service. This is, you can see, the Limb Reconstruction Unit, dedicated in memory of Dr. Peter Salama. This place used to reconstruct limbs of patients that otherwise would be amputated. Now this place is no longer operational.
So we have seen the Health Workers for Palestine grassroots movement grow now from vigils that started here in London outside 10 Downing Street as a way to draw attention to the fact that healthcare workers were being deliberately targeted and that the healthcare infrastructure was being targeted. Also to mourn the deaths of those that had been killed and to pay respects as health workers to the health workers in Palestine. But it's also now grown into a global movement across 60 cities around the world and has turned into a movement of soft power and soft activism with a very unique and special voice, because healthcare workers take an oath to do no harm and to stand up for justice and to stand up for human rights. And many of the healthcare workers here in the UK and across the globe feel that they're not able to stand true to those oaths that they've taken if they were not standing up for Palestinian health workers right now. And so what we've seen is not only a beautiful movement and grassroots movement on a community level for solidarity with Palestinians, but also in solidarity with international human rights and humanitarian laws, and healthcare workers coming out and dedicating countless hours to protecting these rights and these international laws. I think it's really important that we draw attention to the fact that the healthcare infrastructure was struggling in the West Bank and in Gaza well before the 7th of October, that this has been years and years of decay essentially being allowed to happen to the healthcare infrastructure due to the occupation, due to the restrictions that the Israeli government and the Israeli occupying forces place on Palestinians, and the healthcare does not escape these restrictions.
شردنا من بيوتنا اجينا على المستشفى، لحقنا القصف حوالين المستشفى. مدير المستشفى جاء تهديد من جيش الدفاع الإسرائيلي، يا عالم اخلي النازحين من عندك. وين بدهم يروحوا 15,000 نازح في المستشفى وين بدهم يروحوا؟
The health system in Gaza, as this hospital, has been torn into pieces, fragmented, unable to sustain itself, and unable to provide basic, essential clinical care to patients and people in need. We only see the tip of the iceberg, the injured patients, the trauma patients, but still we have a huge number of other patients with chronic disease and other problems that cannot get the healthcare they deserve because of these fragmentation and distraction, degradation of the health system.
For example, one of the leading killers for women in Palestine across the West Bank and in Gaza is breast cancer, and it's usually because the breast cancer is found at the much later stages because they're not allowed to have the necessary equipment either in the West Bank or in the Gaza Strip to screen women on a regular basis and from an early point to try and catch the cancer. So I have seen the effects that this lack of access to just basic screening services that we would enjoy, for example, here in the UK, can have on a woman and her entire family. When my cousin's wife, unfortunately, was diagnosed with breast cancer, and because it was advanced and she didn't have access to the cancer treatments, she died, unfortunately, a very slow and painful death, leaving behind her children. The youngest one was only 3 years old when she passed away. Again, because there's no palliative care services or extensive hospital services, she was at home, and she lives in a small village. There wasn't adequate access to her to be able to even just offer her necessary pain treatment to make sure that her death was at least a comfortable and somewhat dignified death. So this is just one example of how healthcare across the West Bank and Gaza is completely under attack. I mean, there's a term for it. It's called medical apartheid. The occupation and the apartheid does not just extend to land and to the map. It extends to healthcare, and it is a deliberate tactic being used. Another example is a project actually that the Palestinian Medical Relief Society works on with a group of Danish dentists, ensuring that children have access to dental education and dental care, because what we were seeing was such a advanced proliferation of dental disease in children that you just wouldn't see anywhere else. But because they're not able to afford or able to access dental care, and there's a lack of education within these particular communities, a lot of children were actually missing school because of the pain and the infections that resulted due to the lack of information. And we've actually managed to really make a big impact in preventing these types of conditions from occurring. But you know, it's quite horrific and it's quite devastating to see that children are needing to have their teeth taken out. Often these missions are being done in the schools or in the UNRWA refugee camps, for example, and you know, often without basic supplies that we would expect to see here in the UK. So it's extremely important that individuals and communities and groups like Health Workers for Palestine, for example, continue to not only come out onto the streets to march and to have their voices heard. This is extremely important, and I think for two reasons. It's making sure that people don't forget that what is happening in Palestine is happening. It also allows people an opportunity to come together as a community, to sort of refuel, to be able to come together and feel that there's a certain level of resilience and a certain level of hope together as a community. But it's also necessary that we take some action steps forwards to essentially back up these actions that we're taking when we're going out to march. So it's signing petitions, for example, to stop the attacks on healthcare and to stop the attacks on children and innocent civilians in Gaza, and also to call for a ceasefire. It's writing letters or calling your local MPs. It's continuing the conversation with groups that maybe aren't necessarily aware of what's happening in Palestine, and to just remember that it's not just a ceasefire that we're asking for. We want a permanent ceasefire, and in Gaza that means an end to the siege, and in Palestine that means an end to the occupation and an end to the apartheid, because without that being dismantled, we will continue to see innocent children being killed. We will continue to see the healthcare infrastructure attacked and deteriorate. We will continue to see people dying of very basic medical conditions that if they had access to treatment, they wouldn't need to die. And we will just continue to see that Palestinians are living constantly under the threats of some sort of attack from the Israelis.